Hi everyone, good evening and welcome to EduAdvisor Webinar Central, the platform where we bring you topics you care about delivered by industry experts. I'm your host Nina, and before we dive in, let me quickly introduce EduAdvisor, your go-to platform for making smart education decisions. Now, whether you're exploring courses, comparing universities, or looking for scholarships, EduAdvisor is here to guide you every step of the way. You can also check out our career tools, exclusive webinars like this one, get help with your PTPN application, or speak with an education consultant for personalized advice. Plus, if you apply through EduAdvisor, you may be eligible for exclusive tuition fee waivers, discounts, or application fee rebates with our partner universities. If you're not sure where to start, just head to eduadvisor.my. We're also everywhere on socials, so stay connected with us on TikTok and Instagram for campus insights and fun education content. And don't forget to follow WhatsApp and Telegram channels for updates on upcoming webinars. Now, without further ado, let's get into today's topic, what I wish I knew before starting dental school. It's my pleasure to introduce our esteemed speaker for today's webinar, Professor Dato Dr. Rusdi, Professor of Oral Maxillofacial Surgery from Manipal University College Malaysia. Hi, Dr. Rusdi.
Hi,
Hi, thank you so much for
Nina.
joining us today and sharing your experience. All right, so before we begin, here's a brief introduction of our speaker. Now, Professor Dato Dr. Rusdi is a distinguished oral and maxillofacial surgeon. He graduated from the Faculty of Dentistry, University of Tantan, Egypt in 1983 and earned a master's degree in oral maxillofacial surgery from the University of London in 1995. In 1996, he was awarded the Fellowship in Dental Surgery by the Royal College of Surgeons in England. Dr. Rusdi served as a consultant in oral maxillofacial surgery with the Ministry of Health Malaysia from 1996 until his retirement in 2018. He was conferred the prestigious Darjah Datuk Paduka Serta Mahkota Kelantan yang amat terbilang in 2010. Now, since 2018, he has been a professor at Manipal University College Malaysia. Right. So, doctor, have you got your slides ready?
Eddie.
All
Um,
right. You
I
can you
share.
can yeah, you can share your screen. You can share your slides. So, doctor, while you set that up, to our audience watching, if you have any questions for Dr. Rusdi, type your questions in the chat box at any point of the session, and we'll get them answered during the Q&A segment at the end. Without further ado, Dr. Rusdi, you may start your presentation.
And thank you. Okay. So sorry, guys. Uh, if I could go back in time to meet my younger self, actually, I can be different. I mean, when I attend the dental school, I thought I knew what I was signing up for. I thought dentistry was just about learning teeth, doing filling, graduating with a nice title in front of my name. Okay, but actually, dental school is not just a degree. It trains your brain, your hand, and your character. Meaning that it offer to you much more than just a dental degree. So as for me, I learned it the hard way, and I want you all to learn it better. Okay. So when I enter the dental school in Egypt at that time, I thought that I just sit in the lecture here, the professor telling me about dentistry, so on and so forth, then studying hard, pass the exam, and graduating as a dentist. But actually, it was not like that. Actually, in dental school, you don't just study with your brain. Yeah? You need your eyes because you must see everything in millimeters. Yeah? And your hands finesse must be good, and you must collaborate with your brain, and you must take care of your back, and you must take care of your patient. You must be patient with your patient. Okay, and I say that in dentistry, to get your BDS, you have to sacrifice actually your sweat, tears, and at time blood. Guys, last week I was with my final year student, and I was teaching them, demonstrating them the technique of wiring in the mouth. When you have fractured jaws, so how to wire the jaw. Okay, before you go and plate it with a screw, with a plate and screws. Okay, one of my student nicked his finger, and blood came out. See, and blood came out. And I told them, actually, to get your BDS, you have to sacrifice your sweat, your tears, and the blood. You see, your friend, sacrificing blood. You see, so that's it. I mean, it really a sacrifice. So dentistry actually is not only medicine; it is a combination of medicine, engineering, and arts. So the engineering part and the art part is very important. That's where you must train yourself. Okay, so in dentistry, you are expected to understand anatomy, remember pathology, plan your treatment, then execute with millimeter precision. I give you an example here. If you want you treat caries here, you have to cut with a burr. After you clean everything, when you place the amalgam must be perfect in millimeter. If not, the patient will have high bite on one side of the jaw, and they don't feel like eating because the height of one side is not the same as the other side. And because of that, the patient will feel uncomfortable during chewing and mastication. Yeah? So remember that. Actually, in medicine, in exam, a wrong answer may cause marks. But in dentistry, a wrong hand movement, wrong hand finesse may cause a tooth. Excuse me. Actually, you can memorize everything about the cavity preparation, but if your hands is not obeying your brain and your eyes, your cavity prep may be not to the standard, up to the standard. Yeah? So dental school does not reward brilliant. If you are clever, it's an asset. But actually, your hand finesse, your hand creativity must be good as well. Yeah? And it rewards consistency, meaning that you must do it again and again and again until the skill is second nature to you. Okay, and it's not about studying once in a while. No, you must show up every day. You must come every day to the faculty. Yeah? Okay, and it's not about one good exam. It's about surviving many difficult weeks in a row. In school, yeah, in any other school, many of us succeeded by memorizing, cramming the night before. You can pass, the night before you cram and forgetting everything after the exam. It's normal, but in dental school, that's not the way. You must understand why something happens, not just what happens. So I give an example. If you're a teacher, your professor teach you about nerve pathway, okay, and teach you how to block it, and then you block it, you must know the area that will go numb. So, and also you don't just memorize caries. You need to know how did this patient get caries, how do I prevent it, and you must communicate it with the patient. When you delay, in dentistry, you cannot procrastinate. When you delay studying, practicing, and preparing cases, you don't just lose time, you lost your confidence. So your skill is ongoing, you cannot stop, okay? And the workload doesn't wait for motivation, meaning that you do your work when you feel you want to do it. No, you must do it all the time. It respect discipline. You must be disciplined. Do it a little at a time, but the continuity is very important. Okay. You study small amount daily, but you must revise regularly, continue. Okay. In dental school, cramming does dentist. That's very important. Okay. Practice does. So the practice must be ongoing. Yeah? And then I want to relate my experience with you all when I started holding a handpiece. And then I told myself, why is this so difficult? This handpiece, I can master it in a few, I mean, in a while, see? But it was wrong. It actually, cavity preparation that you look in the textbook, it looks perfect. Yeah? But when you do it with this handpiece, the handpiece is rotating very fast. Okay, if you're not holding it well, your cavity prep will not be good and it will be not lasting. Okay, and also your carving actually in dentistry is just to train your fingers to be very creative. Okay, so that when you carve the amalgam filling or any other filling, you have a different type of filling material. When you carve it, it will become second nature, like an artist, when they create a figure. Okay, so you want your hands to be like that. I mean, it is very fast. It's not that slow, bit fast, but the carving is almost to perfection. I just call it a masterpiece done by you in a patient mouth. Okay, so the hand skill when you hold that handpiece is not inherited. I mean, you can be a novice at first, and later as you train it, you will improve. Okay, so repetition is very important. Then you must stop comparing yourself with your colleague. Yeah, you grow and progress at a different rates. Okay, so what important is that slow hands actually are safer than careless hands. So you can be slow, but you cannot be careless, because careless means you will it'll be dangerous. Okay, because your hand is very fast. Remember, then in dentistry, speed without control causes damage. So the handpiece, the speed of it must be well controlled. Okay, the control of the speed is your leg. You are pressing on a switch on the floor. Okay, so precision without speed creates trust. Without speed, I mean that you must be very precise. Yeah. So it's very important. Then every mistake you make on the plastic stage, okay, prevent mistake on the real patient. So meaning that you must practice a lot. Yeah, practice a lot, because that will prevent mistake on the real patient. So when you fail your practical, don't worry, because when your appropriation is rejected, you will do it again. You will do it better and better and better. Okay, in dentistry, when your preparation is rejected, it's not failing. It is training. Okay, and dentistry is muscle memory. So you program your muscle to do the arts. Okay, the arts, and you can recall later when you have trained your muscle, it is being programmed. Yeah, it will program in your brain, and then later when you want to carve, so on and so forth, the muscle will help you, okay, because of the constant training, okay. And muscle memory is built through struggle. Okay, your patient will teach you a lot, really. See, the textbook are clean. Everything in the textbook that you see, whether it's orthodontic, whether it's oral surgery, the way you make an incision, so on and so forth, looks very clean. But in patient, it is not. Okay, the books show perfect cavity, perfect gum, complete mouth, but real patient are different. Patient have fear, anxiety, pain, anger. Okay, they mistrust you, so on and so forth. So you must be, I mean, the communication, the empathy, problem solving, and emotional control must be good. I just want to relate you one experience. Yeah? Last week there was one patient who came to the oral surgery department for the removal of one impacted teeth, and the patient was very scared. And the clinician was not good in, communicating about the surgery to the patient. I mean, he did not explain well, and he did not say to the patient that, there will be no pain. My local anesthetic will be very good. I will give a good local anesthetic, and I make sure if there's pain, we will give more of the LA. You don't worry. This surgery is a routine one. You must trust me. I give the LA, and then I will check it, okay, objectively and subjectively. I make sure it works. Then I will start, okay. And you must try to win the patient trust. So that patient went back because patient was so scared of the operation, and the communication break, okay, break. Then I told that clinician, please recall the patient. I meet the patient and I explained everything. I reassured him, okay, there'll be no pain. You don't need to worry. So I mean, communication must be, repeated, okay, so that the person could understand well, and they can sort of that will resolve his empathy, his scared, his anxiousness, so on and so forth. Yeah. So when I did that, then I could proceed well till I remove the tooth, and we suture well, and we give the post operation instruction to the patient. You see, communication, empathy, very important in that, because the fear in patient is real, okay, and the anxiety is real, okay. You must address that. You see, some of patient will not listen, so you have to repeat again and again until the patient is clear of what is going to happen. Okay. Some patient will be late, and you have to address that. Some patient will call you and cancel the appointment. Okay. And some will be afraid of you because your explanation is not clear to them. They may harbor some confusion and need further explanation. Okay. And you will learn that being a dentist is not just fixing a teeth; it is managing human. So you all have to address all the patient's problem, like they're not listening to you, late, canceling appointments, so on and so forth. Okay, so a technically perfect feeling means nothing if the patient is terrified and never come back. So if you own a private clinic, if your patient never come back, then you will lose the profit, okay, for your company, for your clinics. So a simple session done with kindness can mean more than complex treatment done coldly. Yeah. So the kindness, the understanding, so on and so forth is very important. So good dentist versus great dentist. To me, good dentist treat teeth, great dentist treat people. That is our aim, okay, to create great dentists. And this lesson cannot be learned from slide. Yeah, like my slide. Yeah, it will be in a real clinic, real chairs, real mouse, real fear, and real patient. You see, in dentistry, failure is part of the training. Dental school will humble you. You will, you will fail practical. Will be told to redo cases because it's wrong. At times it get scolded, but rare nowadays, yeah, because we tend not to scold our student. At times you feel stupid, but it is okay. Eh? You must be strong, okay? But some students will break at this stage, and we have counselors. Even some of the professors, they know how to counsel this kind of patients, the student. Actually, failure is not a sign that you are not meant for dentistry. Remember, I put in red, failure is part of the curriculum, because when you fail, that's the way how we improve yourself, okay? We will explain again and again, show you, demo again, yeah? And supervisors, the professor, associate professor, senior lecturers are not trying to destroy you, no. We are trying to protect future patients. So every rejected procedure is prevented disaster. Yeah, because when it is rejected, we will ask you to do again a better one and with a better understanding. Yeah, and always remember this in your mind. Problem is not failure. Problem, problem is only when you give up. That's a problem. Okay. If you quit every time you fail, you will never become competent. So competency is when you do it again and again, and you train yourself. You train your brain, your eyes, your hands, okay, in doing it perfect. Okay. So failure actually train safety. Okay. And safety is built through correction. We need to correct again, correct and correct again. So you must not ask why I'm so bad. You are not bad actually. In dentistry, you are going for perfection. Okay, you are not bad. When you correct you're okay, but we want you to do better, and reach the perfection. That's why in dentistry we always say that you did it right. We always say that is your masterpiece. I always, when my student comes to me with their work, if it is good, I write it and give a write, and then I will write there, this is your masterpiece. Yeah, it is masterpiece because you do it yourself, you see. You create it. Yeah. So you always ask yourself, not why am I so bad? Ask yourself, what can I improve next time? Better next time. And this is how clinicians are born. Okay. So, and then one more thing is that mental health matter. Okay. This part is very important. Okay. Dental school is stressful. Yes. Okay. Not just because of exam, but because, stressful because of the patient quotas that you have to achieve, the requirements, not only in one department. Your requirement will be in OS, like in oral surgery, oral maxillofacial surgery. Your requirement is like you have to accept 15 teeth. in 3 years, year 3, year 4, and 5. And in year 3, you have to do a lot of suturing. There are about 8 techniques. Each technique, you have to do about 25 suturings. Okay? I mean, let's say one type of suturing, like continuous interlocking, yeah? You have to do 25 of that. Okay? It's a lot, yeah? But that how it train your hand to suture well. Okay? And then the time pressure, you don't have enough time actually, so you must be very cunning with your time management, yeah? And then the evaluation is very strict. Okay, and we know some of you lack of sleep, okay, and fear of mistake. All this may cause some student to suffer, but we are here to help you. We always take care of our student, and we help them when they face all these problem. Yeah, okay. We want our students to be mentally healthy. So actually, in dental school, we have so many extracurricular activities like sport, games, and also club. So many club, debating club. We have speaker corners, so on and so forth. This just to give you some form of rest out of the study. Okay, this will relieve the stress that you face during the day's work. Okay, and then burnout is real. I've met a few students who have this problem, and we successfully treat this. We get the help from our counselor. We have many counselors in our faculties, and then the anxiety is real, and it can be addressed. Okay, then depression. Okay, that also occur from time to time, and also most of our students survive. Okay, all this burnout, anxiety, depression, and we are very concerned with this. And if the our student has this problem, we will counsel them. Okay, then you must remember, you are not a machine, so you need all the rest, friends. You need the laughter, meanings, spiritual grounding, so on and so forth. That's why we always encourage our students to, I mean, during their free time, in the afternoon, evening, so on and so on, to engage themselves in so many extracurricular activities. And also we bring them sometime to the town and to have a sort of a good dinner. I mean, we talk with them, so on and so forth, over dinner. Okay, sometimes lunch, we bring them out. So all this being done from time to time. So sometimes actually the most productive thing for you to do is just take a break. Take a break. I mean, during weekend, yeah, take a break. You can go back to see your parents, so all your friends in other university, so on, so on. So this is very important. You must stop and breathe. Okay, very important. And because we want our future dentists to be not exhausted dentists, because that's very dangerous, yeah. And we want you all to be, I mean, not empty inside. We want you all to be a full human with all the knowledge that, I mean, you enjoy life, not just this work. Yeah, okay. Enjoy life, see your friend, take a break, go for holidays, so on and so forth. Yeah. So your mental health is very important in dentistry. It is not optional. Yeah. So healthy, a good mental health is part of your professionalism. So you, as a dentist, must have a good or superb mental health in order to survive this challenging world. So remember, grades is not everything in dentistry. We don't tell our student to go and I mean reach the sky with a good grade, so on and so forth. No, no, no. Because in real life, you realize that patients do not ask for your CGPA. They will ask, does it hurt? Okay, will it work? Can I trust you? Okay, or can you relieve me from this pain? Okay, can you treat this? I'm suffering from this. Okay, like TGN, trigeminal neuralgia. It's very painful, and sometimes it drives patient to suicide. So we want you to treat that. Okay, so treat it well as how we train you, not going for a good grade. Yeah, no, 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 no. You must be a good dentist, trusted and very safe. Okay, and actually, your employers in the future don't just look at the marks that you get in the university. They want to see your attitude, discipline, communication, responsibility, and skill. Your skill. Okay, and that's where we put important to our patient to acquire all those skills. Okay, a safe dentist with average grade is better than a careless dentist. Yeah, we try as far as possible to make you a very safe dentist. Okay, we do not want to produce careless dentist with high grades. Yeah, we want to produce a safe dentist. Yeah, and you must aim for excellent in your work. Okay, and don't destroy yourself chasing number. I mean, chasing good grades. Okay, you are trying to become a clinician. That you must remember, not going for a good transcript, yeah, with a super mark. No, we want to make you or turn you into a average grade, average, but excellent in your work. Okay, professionalism start now. When you join as a student, you're already a professional. But year one and year two, you will you will train to structure thing, structure a tooth, okay, make it perfect, so on and so forth. And then in year two, we'll start doing some of the prosthetic works. But in year three, year four, and year five, you start treating patient. So actually, by year five, when you graduate, you're already a full-fledged dentist. You can treat. That's why dentists like during my time when I started work, I'm already a full-fledged dentist. I do all the treatment. Okay, different from medicine. Medicine, they don't treat patient during their clinical years. They treat patient only during their housemanship. That's why when you become a dentist in the Ministry of Health, your grade, no, your pay is a full pay for a full-fledged dentist. But for medicine, they are not a doctor yet they are housemen. Their scale is lower than you, okay, because they are not full-fledged as you. They are just housemen. After they are housemen, then they will get a full-fledged pay as a medical doctor. Okay, that's the difference. You, in your first year in the work, you are a full-fledged dentist. You treat as what you have been taught in the university because you are treating patients at the university in year three and year four and year five. Okay, so professionalism means now when you start your study, you must very punctual. You must very honest with your teachers, with the staff in the university, and with the patient. Yeah, respect for patient, respect for staff. And then you must practice infection control all the time. It's bad if you pass infection to patient, from one patient to another patient, or from you to a patient, or from staff to a patient. Okay, and you must learn well about ethics, the ethics in your work, in your relation with staff and patients. Then in dentistry, you must not afraid to ask. You must ask a lot of questions, and you must practice a lot. Don't complain. Practice make perfect. Practice make perfect. Respect your lecturer and your nurses, your DSA, dentistry assistants, and so forth. Then take care of your hands and your back, because the way you sit on the dental chair is very important, because otherwise you will get backache sooner. I don't have backache until now because I was taught ergonomic, and I really position myself when I am treating patient. Then learn to talk to patient early. I mean, how to get close to them and win their heart. And if you win their heart, you can treat them well. Okay. And lastly, but most importantly, protect your mental health. And conclusion is this, okay? Dental school is hard, but it's for a reason. It's not designed to make you suffer. It's designed to make you safe. A safe dentist, that is the aim, okay? Then you must, if I know everything about what I say now as a old man in dentistry, okay, I still will choose dentistry, okay. But of course, when I started the work in dentistry, I would be more prepared, like not like when I was when I started before. Yeah? So to those who are just starting, actually you are not weak if you struggle. That's common. Okay, I too struggle. Okay, you are not alone if you feel lost. You're not failing if you fall. You are becoming. You are becoming the professional that you are aim for. Yeah, with the title in front of your name. Okay, and all that process is never comfortable. Remember, it's not comfortable, but it is meaningful. Thank you very much.
All right, thank you so much, Dr. Rusdi, for the insightful presentation. We are now nearing our Q&A segment, so let's look at the questions that you have for us. Right, so Doctor, I'll just pull it up for you, lah. I'll just verbally say it. So the first question we have is from Shuman. She asks, my biggest concern is accidentally hurting patients during clinical studies. Have such cases ever happened, and do students get penalized after?
Oh, thank you. That's very important question. I love that. Actually, you see, in dentistry, you start treating patient at year 3, 4, and 5. Okay, when you start treating patient, we will be there all the time. You will not hurt patient. Okay, I give you an example. When in year 3, this in oral maxillofacial surgery. In year 3, we teach our patient to give block. Okay, we teach everything first on the model, and then we teach them how. The teacher, the professor will show them how to inject in their friend. Okay, and then they must inject each other. When injecting each other, they cannot inject if we are not there. We are there, and we scrub, the students scrub, we scrub as well, and then we show them if they know where to inject. Okay, we leave. But if they swirl, what they call swirl, you go to other direction, we hold their hand and we follow through, and we inject into the patient mouth, in the area of the nerve where we want to block. Okay, so it is very safe. So the same with orthodontics, with pediatric dentistry, with any procedure in any field, the professor or the professor or senior lecturer will be there and guide you. And yeah, at times there were accidents, but minimal because we are there. You cannot proceed on your own. Yeah, all the time you are there. You are not being supervised. Only when you pass, you get your BDS and you work in the Ministry of Health. That there'll be no supervisor at your side. But in the university, don't worry, you are safe. The survivor will be there. We won't allow you to proceed, okay, without we watching you. So it is very safe, okay? Don't worry there.
All right, thank you so much, Doctor. Move on to the next questions by Megan. She said, I heard that dentistry requires creativity and artistry. What does that mean?
Oh, please say again.
I
What
heard
the
that
Megan asked.
dentistry requires creativity and artistry. What does that mean by that?
Okay, thank you very much. That actually creativity is that, okay, you see, we tell you basic, the principle, like, okay, the way to extract a tooth, this is the way, okay, but along the way, as you progress, you have a special way, your style of doing it. If you do it that way, but based on the principle, you are not away from that principle, that's creativity. You can invent, I mean, you can do it your style, but based on the principle that cannot be changed. For example, we tell you how to extract a tooth. Okay, we say that when you want to extract a tooth, there's a movement, yeah, a movement like lingual direction, and then you say that you rotate a bit. Okay, that is the principle. You follow this movement, okay, bacolingual, meaning that you go into the mouth, into the cheek, and you rotate. But the number of movement is up to you as you grow. I mean, as you achieve more experience, as you do it many times, many teeth, sometimes the movement of the bacolingual direction, maybe you prefer more. Okay, maybe, or to you, I want to do it 5 times. Okay, then I do rotation 2 times. That is the gravity, your own choosing. Okay, but the basic principle of bacolingual and rotational is there. That is the basic thing. But the number, okay, is up to you. And some of you, I mean, we taught you that, okay, during the last movement is buccally, but some of you prefer lingually. It's okay. It's okay. Okay. So these minor changes that create your I mean that relate to you. You want it that way. Okay. And it's not the simple thing. It is the minor variation that you want to change. That is the creativity. That is permitted. Same when you create a denture. So the style, the shape, okay, it's up to you. You can do that creativity work, but the main thing, the shape of the denture must follow the principle. It is the horseshoe shape denture that at the back it hold the posterior maxilla, where the back of the denture just hook on that. You cannot change, but the shape, the thickness, okay, the way the shape of it towards the anterior, where you have the incisive papilla, so on and so forth. You want to reshape it. make it more, I mean, more, the figure more, the present is being felt more by your tongue. That's okay. Okay. So the basic principle must not be changed, but the little variation that make it comfortable to the patient is allowed.
All right, understood. So move on to the next one from Oliver. What can I do now to make sure I'm ready for dental school later?
Okay. First and foremost, it is good if you go and see the dental school itself. Okay, have chit chat with a few of the student and ask them, how can I, you know, come and start doing work with no hesitation. How do you start your work here? How you deal with the patient, with your colleague and your professors, so on and so forth. And how do I allotted time to my study, to my requirements, so on and so forth. They will tell you, because these people have experienced it and they are doing it now. It is better to see them. Okay, and also if you have the courage to see the staff, lecturers, so on and so forth, you are most welcome. But because now the university is not like before, it's closed, yeah, to student or to student who are becoming, I mean, becoming student. Okay, no, we are very open. Can come and see us. Okay, all right.
Right. Moving on, this is from Tanya. She asks, do you think you need to love chemistry and be good at it to do dentistry?
To be frank with you, actually, later on, if you want to do research, chemistry is a must. So my advice is that nothing in the curriculum towards dentistry will lay to waste. You must try to grasp everything, because chemistry is part of the nature of the thing that you are going to work with, like the teeth, the dental materials, the diseases, so on and so forth. It is associated with chemistry. The cell, the foreign body, the bacteria, so on, so all related. It's about chemistry. Actually, it's about chemistry and biology. So this must be mastered well. And of course, they say that physics not important. I think important, because as I've said earlier, dentistry is technology. Technology. So we use a lot of physics, like in alternative surgery, where we move the facial bone, just to correct the facial anatomy. In patient who have unbalanced face, yeah, unbalanced occlusion, so on and so forth. So all this, the movement, the way that we reposition the facial bones, so on and so forth, it's correlate with what you have learned in physics. Okay, so physics is also important. So learn all. You it's not wasted. All that information will be used later in your clinical works. And okay, just to add, in orthodontics, where you move teeth, so on and so forth, it involves a lot of physics. Thank you.
All right, that's a very enlightening, doctor.
Yeah.
Another one from Shakira. She asks, I acknowledge that dentistry do need a precise hand. What can I do now to obtain that?
Okay, as I've said earlier, no. You when you start work, you will do a lot of training. You see, and the training will sort of expedite, make the movement of your finger good and in line with the brain, and also with your vision. So in dentistry, we are not talking in centimeter. In dentistry, we are talking about millimeter and microns. You see, the in orthodontics, where they move this, okay, they measure in millimeter, no centimeter, not 1 centimeter, no, 1 millimeter, 3, 2. When we move, the facial bone is what, millimeter as well. And also when you are treating caries, so on and so forth, or when you are making denture, if a few millimeters off the way, the patient will feel uncomfortable. That's why your eyes must be very good. Your eyes, your visual thing must be very good, and your brain must be fresh. You must not sleepy, so on so because you miss the measurement, so on and so forth. So in dentistry, we talk about millimeter and microns. Smaller than millimeter, and because of that, you must be very healthy. I mean, your eyes good, your brain good. That's why just now I talk about mental health. You must not be. I mean, in the class, in the clinic, very sleepy, very tired, so on so. That's why we always stress to our students. You must lessen your engagement with social media. You must sleep early. Okay, remember this: sleep early. That's what's the proverb there. Early to sleep, early to rise. Make you healthy, healthy, mental health, healthy, wealthy, and wise. You will become wealthy because you will become a successful dentist. Okay, and because of that, successful dentist, you become very wealthy because you will have so many patients. Your clinic flourish. You will open more clinic. You will hire more dentists, and you will become
Healthy.
not a millionaire, maybe a billionaire one day. Okay, all right.
All right. Okay. We'll move on to the next one from Sean. Are there any subjects or coursework that dental students typically struggle with the most?
Okay, actually, from my experience here in Manipal, they struggle actually with dentistry, community dentistry, because community dentistry is a subject that it is not like orthodontics. You do and you have a measurement of it. Okay, the amount of movement, so on so. Like in extraction, you must extract it well. The tooth must come out. It must not broken, so on so. But in community dentistry, is how you make the community uh, appreciate appreciate dental health. And I mean, one, the dental health is good, the body health is good, but the way to achieve it, there's several ways, and it is unique because not one way that is applicable in all the country, because we have different kind of population, different kind of environments, and the different kind of uh, 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 laws, so on and so forth. So when you have one model and you say that this is right, why it's right? It is not like I mean, you have to think of so many factors to make it suitable in that particular environment, in that particular place. So it is something that controversial. It, it is not plain black and white. Okay, something in between. And in exam, you have also to answer in that way. Community dentistry is no, that's not right and wrong like that. It is not black and white. It's something in between that it's difficult. So that's why in exam they say that sometimes in community dentistry, it's difficult for them to achieve a good rate, unlike in orthodontic, in consultative dentistry, in endodontics, and so on, because the other field is straightforward. This right, this wrong. Okay, in community dentistry, no. Okay, you have to think a lot. You have to apply several things to make it happen, and that is acceptable. And the result, you have to wait. Okay, same with public health. In medicine, public health and community dentistry is the same. it's not pure black and white. I think
Understood.
that is the difficult subject. What the student has told me, this is what I relate now.
Hmm. Okay, understood. Thank you so much for that, doctor. What the next one? This is by Yi Ying. They ask, what are the traits that a dental school would like to see on a potential applicant, and how can a student prepare for an interview into dental school?
Okay, thank you much. Actually, there are so many traits, but if you score well, if your attitude is good, and you are not the kind of person that you that you know if you come and we see you like you stress on nitty gritty thing. I mean, small thing. We want to see you as an overall human being who care for everybody. So you don't you're a human as a whole. If we see you, you're towards particular trend, you are not you're biased, then we don't take you in, because dentistry you must treat all people equal, all patients are equal. We not racist. If you have that kind of threat, a trait like racism, we won't admit you. We want somebody that I mean, it's not perfect, but overall acceptable as a acceptable human being. I mean, that's what we stress for. Okay,
All right,
that
understood.
answer that
Yeah,
question.
I think that answers Ying's question. Mm, but how can a student prepare for the interview into a dental school? Because I think we were talking about traits just now, but how can a student prepare if they want to get into a dental school?
Okay, actually, uh, there's a manuscript where we want all the qualities that are with you. So this quality, like, first we want someone that can explain their, I mean, what they want in life, just like that. I mean,
Mhm.
explain well, and then what you're aim for when you do dentistry, what you aim for. If you say that I want to do dentistry because my dad asked me to do, then we give you minus mark for that. Okay,
Mm.
and we want somebody who, I mean, we see that this guy is committed, and there's a way to ask you, to see whether you are committed of doing dentistry, because as you are as you have heard what I say, in dentistry you need someone who is a survival type of student. Survive, they will survive. I mean, they're a fighter. I want that kind of guy, a fighter. We don't want to see somebody who are, they are not strong in character. They are not a fighter. We want a fighter because it's 5 years. It's a long time, and you have to go through so many ritual, so many treatment that you have to train and perfect it until it becomes second nature to you. So we don't choose a guy who is perfect, but someone close. Okay, yeah, as I've said, someone that you see, oh, I can trust this guy. This guy will become a good student in the sense that this guy will survive. He's a
Mm.
fighter. He won't give up early. So our question will gear toward that. And one more important thing is that we do not want a student with very, very, I mean, uh, we want extrovert, not introvert. I mean, in dentistry, you must mix with your friend, with other student, with patient, with staff, with professor. So we prefer extrovert. If we have two candidate, one is extrovert, one introvert, we will take the extrovert for real. I mean, this is what we do from time to time. So you must be extrovert, okay, and you must be active in most of the thing. I mean, in sport, in club, like in speaker corner, in I mean club where you do social activity. Okay, you go to people, help people, so. Because in Comden in dentistry, they used to go and to all folk home or all these kampung areas, so on and so forth, in the orang asli area where they do charity work in terms of giving free dental treatments. So all this will come into account. We will see somebody who are not confined to himself or herself, but very open-minded, and can share things with you and can explain well what they mean by a certain thing, so on. So we do not want to be to have someone who is introvert to himself or to herself. No.
Mm. Yes, I understand because I mean you did mention that it is about managing people.
Yes.
So
Yes.
it's only fair that you know how to talk to people and handle
Yes.
people to join
That's
the
very
field.
important.
Understand?
Yes, Melina.
Um, all right. So I think we have one question related to Manipal University. What kind of facilities does MUCM have for dentistry?
Okay, this I can share very well. I am here. Okay, so I was in the Ministry of Health before. Okay, in the Ministry of Health, the equipment, the instrument that we use are up to date. Okay, so I'm very senior, and also my friend, the orthodontist and the endodontist, the condense and so forth. We are exposed to a lot of good instrument, fine uh, 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 machine that help in our work, and all those can be found here. And here actually is well equipped. And I just want to add one thing to show that I'm not biased. Yeah, I'm not biased. See, if I'm biased, I want to see give a proof now, guys. Now it is better to study in the country than you go outside. Okay, now in 2026, the Malaysian Dental Council has introduced what we call it professional qualifying exam, or we call it PQE exam. Okay, PQE exam starting in 2026. If you go and study to Egypt, or you study to UK, and you go and study to Australia, when you come back, you have to sit for this exam. Okay, it will start in 2026. So the next cohort of students who went overseas come back, they have to sit for this exam. This exam is a difficult exam, expensive, costly. Yeah, the fees to sit for this exam. And before you sit for the exam, you must attend the courses. Okay, these three things will involve a lot of money. So you better study in Malaysia. Okay. And why I say that MUCM is good, because the venue of this exam is only at three places. One in USM, University Science Malaysia in Kelantan, Kota Baru, in University of Malaya, and the third place, where? The third place is in Manipal. Okay, this exam, PQE exam, is very prestigious exam. You can only practice if you pass this exam starting 2020, starting this year. Yeah? And so if the exam is being conducted here and the other two, so that means that the standard of MUCM is high. It's good. It's good. It's on the same level as USM and UN, because this prestigious exam, I repeat again, is professional qualifying exam, PQ exam, will be started in 2026. And the three places is USM, UN, and MUCM. So has that answered that question? That to show that the quality of knowledge to be gained from here, and
MUCM.
MUCM, and most of us who are the head of specialty in Ministry of Health last time are here. Okay,
Mm.
so that speak the quality of the work being done here and being shared with our students.
Right.
Thank you.
Thank you so much for the doctor. I'll just move on to more of the questions. Um, so Megan asked, this is I think related to post studies lah. I understand that dentistry graduates will need to undergo a year of compulsory service. Can you explain what happens during this time?
Or the compulsory service, yeah. During
Mm.
this time, you are not a houseman. No, no, you're already a dentist, and you're exposed to the variety of work in the okay, in Ministry of Health. The specialists are either in the hospital or in the main dental clinic. We call it main dental clinic. There are a few specialty, yeah, like in the hospital is oral surgery, oral maxillofacial surgery, oral pathology, oral medicine specialist, and then pediatric dentistry that treat children, and fourth is we call it, I forgot the name actually. That's we treat patient with incapabilities. Okay, patient that couldn't walk well, so deaf dental needs we treat in hospital. So there are four specialty. One more, geriatric dentistry,
Mm.
geriatrics. So five. The other five or six like orthodontics, conservative dentistry, endodontic. Endodontic is through to treat your pulp. Yeah, they remove the nerve and your teeth can be restored and there'll be no more pain, yeah, because your nerve has been removed. There is endodontics. Then of course there you have community dentistry, and one more, if I'm not mistaken, is prosthodontic, where they make denture. So about 10 specialty, five in hospital, five. So they will rotate you through all these 10 specialty. That will be in 1 year. And then after that, if you perform very well, the government may retain you, and the rest you can work in the university, in the private sector, in the private hospital, or in the army, yeah? Or you want to open your own practice. So after a year, they will decide where they want to put you. Okay. So if you stay in the government, most probably 30 to 40% of you will retain in the government. The rest will be not to ask to leave. I mean, they give you option to go enter the army, join the army, or the university, or in the private hospital, and also in the, I mean, open your own practice. Okay.
Okay. I want to piggyback on this question. And also, we have a question from Hanif as well in relation to this. But my question is it compulsory to do your services in government hospital, kind of like medicine, or is it okay for dentistry to do their compulsory services
Oh
in
yes,
private
yes,
hospitals?
yes. It is from 1 to 3. If I'm not mistaken, 1 to 3 years now. After 3 years, they if perform well, if the government wants you, they will retain you, and the rest will
Mm,
be free, set free. Yeah, it's still compulsory
I
for dentistry
see.
between 1 to 3 years, same as medicine, one
I
to three
see.
years. Yeah.
All right. Now on for Hanis, she asks, what is the system like? Do they have OT on calls or is it completely different?
Oh yes. Okay. In the hospital setting, you have to do on call because there are a lot of trauma cases affecting the head
Mm,
area. So that will be under oral maxillofacial surgery. And also if that trauma happened to a kids, then you learn all those in pediatric dentistry during your attachment at the pre dentistry. Okay, inpatient, I mean, old age patient, you have geriatrics, dentistry, geriatrics, yeah, and also you have this patient with special need. There's another, there's another specialty. We call it patient with special need. The name I forgot. So there are five in the hospital. As I've said earlier, oral maxillofacial surgery, peds dentistry. You have this oral medicine, oral pathology, then you have this geriatrics dentistry, and you have that patient with special needs. Okay, so these five.
I see. Okay, so I think we're kind of crossing over the allotted time, but I'll just ask one more question from the audience before we close our webinar for today. This is from Nandi Kashri. She asks, she's wondering to take A levels as a pre-U. What are the best subject combos for that dental schools look for?
Or the subject combo, yeah?
For A
Actually,
levels.
is maths, biology, and chemistry. That's the best combo. But if you do not want to do A level, you can apply straight to the university and you can do the basic course here. It's also 2 years, but after that you can go straight into the either medicine, dentistry, or other health specialty like occupational therapy, physiotherapy, so on. So we have here we have five. We have medicine, dentistry. We have occupational therapy, physiology, and one more psychology. So five being offered here, and we have this what we call undergraduate course for 2 years. You can come straight here, do that 2 years. After that, you can enter into one of these basic courses.
All right.
The 5 professional courses. If you don't like to do A level.
Okay. All right. Okay. All right. Thank you, Dr. Rusdi. Unfortunately, with a heavy heart, we'll have to end our session soon. We've gone over our limited time, so we won't be able to take more live questions. But before we close, Dr. Rusdi, do you have any final words of advice for students who are anxious about pursuing their dentistry studies?
Yeah. Actually, dentistry is very interesting because you combine studying with practicing together. In year 3, year 4, and year 5, you are realizing you are really working with passion. I mean, from 8 to 5, you are working. Of course, there are lectures from time to time, but most of your work will be in the clinic. You are seeing patient from 8 to 5, and not only in single specialty, all the various specialty. So you have been trained to master your hand, to master your eyes, and your brain must be coordinated. Yeah? The brain, the eyes, and the hand together. You'll be exhausted, but you will feel that it's worth the work because you are really learning the what do you call it, something that tangible. You learn how to do a lot of things, and also you learn how to communicate with a patient. As I've said earlier, there are so many problems. Patient is not clean as in the textbook. Clean patient, patient will obey you. So no, patient will argue with you, but you have re-argue again, and give your version of the best thing for her. Okay, you are giving what the patient need, not what the patient want. The patient want a lot of things. Please, can you do like this, like this? But based on your education, that is not what the patient need. But you as a professional, you must convince patient to accept what the patient need actually. Don't fall down to their trap because they want what they want. But what they want actually is not good for them, for their dental health. So this part is very critical. You must understand it well, and you must understand the technique of convincing them to follow what is good for them, not what they want. That's very important. That's critical to me. And this is what you call soft skills that we will impart to you in the university.
All right. Okay. Thank you so much, Dr. Rusdi, for sharing your valuable insights with us today. And to our audience, thank you for your participation. It's been a pleasure having you with us. If you have further questions about dentistry or MUCM, you may send your queries to us at webinarcentral.support@eduadvisor.my, and we'll answer your questions there. We hope you've gained some useful information from the session. Dr. Rusdi, it's been an honor to have you with us for this talk. Have a great day, doctor, and goodbye.
Bye. Thank you very much.